ankle and the top, and
He was on TV.
don't do it because too hard because some women are very skinny.
All right, guys.
Welcome, one and all to another episode of Tri Virtual
Roundtable.
Yes,
There we go.
thank you.
How's everybody
So
doing?
today is Easter, or not Easter. It's not Easter. It's
Mother's Day.
Yes. So happy Mother's Day to all those out there.
All the mommies.
Just wanted to wish everybody, my mom, Donna, happy Mother's Day. My wife, Tracy, happy Mother's Day. She's the mother of my children. So I just want to just point that out. And what number episode? We're on episode 13.
Can we say hello to our mothers?
13. I'm going to pass it off to Doc to talk about his
Healthcare.
mother.
Look, happy. I don't know if my mom was able to join, but happy Mother's Day, Mom. Rose Smith out in Arizona. And I hope you have a fantastic day and all the good stuff. I'd be here too long saying all the good stuff.
There we go. 11 Goddesses on. We're on break. Hey, 11 Goddess. Hello, how are you?
Welcome. Thank you for
What's
joining.
up? All right, Devlin, what do you got for Mother's Day?
Happy Mother's Day to my wife, Happy Mother's Day. And obviously, my happy Mother's Day to my mom that has passed away. So happy Mother's Day to her. Happy Mother's Day to all the mommies out there. So just real quick before we go any further, I am sick, so it's their lucky day.
Yeah.
I'll give you guys some.
He'll be talking less.
Yeah, so I'll be talking a little bit less today.
And the crowd's going wild.
So take it over, guys.
All right. Well, today we're gonna. Doc is actually not only our host, but he's also our guest because he has written a few books about healthcare for feet. One is just general natural feet, and then the other one's about diabetic. But he's helped us create a charity initiative also that we'll be talking about a little later called Heart. He'll explain that. And he's also creating a big health area in the multiverse. So it's kind of like, VR healthcare in the multiverse. So I guess I'll just let him start taking. I do have some questions when they come up. I know a couple of comments will be coming through. Questions. My mom had a couple questions because my father has diabetes also, like I do. And so I know it's a kind of a general topic today, but I specifically have some foot questions. So anyway, Doc, take it away.
No, I'm here. Look, I really appreciate the intro and some of the stuff I've done. Thank you. And what I want to say to Devlin, the reason why we're trying to get rid of him, because all my videos he could have chosen, every single one that I've done for television, he chooses one where I do a foot massage, which has
he's the television star.
Really, out of all, please. Yeah, I did that a long time ago in Florida, and I don't remember the producer's name, but kudos to her because she really brought me on whenever I wrote a new book. So I really want to say thank you.
Well, I'll just say this: you did look good, though, Doc. Come on,
yeah, look good. You see the maroon and the little vest thing, right? All you ladies out there, I don't look that good anymore, so I apologize.
They don't know what you look like right now. So
I want to make it up. This is all like AI right here. But look, thank you guys. I really appreciate everybody coming out, our Multiverse family, as well as family and friends and those mothers out there. Fantastic day. Iceman and I were talking, as well as Devlin, talking about how important healthcare. And as Iceman said, I created a healthcare area in the multiverse. And you know the name of our show, Tri Virtual Roundtable, and what makes us different than a lot of shows out there is we're trying to create a segue of real life and how it integrates into the metaverse. And if you don't know what the metaverse is, in virtual reality, these little devices right here, the VR headsets, is really how you can access some of the things we're going to be talking about. So let's start out, and which is everybody's question: why feet? I guarantee a lot of people are like, yeah, why feet? Devlin, where's yours? Oh, in the back on the fancy charger thing that none of us can afford but you. Listen, so look, when I first came into VR, obviously I was as lost as everybody. Let's try to figure out what was going on. And once I started figuring things out, I realized it was the perfect platform to create some sort of health initiative. And as everybody was developing what they were developing, it was, I figured that was my niche, as the virtual world is growing. So I create VR healthcare. And the goal of that platform, and again, that's in virtual reality, is to create a hub where people can come together and discuss health problems. It could be medical or allied health. And these guys helped me grow it. You guys did when you first got there. You guys helped me set that up in
Ran
a
the street.
sense. So
Yes, we did.
We got him some money.
Yes, we did.
Worked the corners. That's right. We worked the corners for him.
Yes, we
so
did.
after I scammed these two fools, I was able to continue to develop VR healthcare into something that was really, really, really cool. And in the future, we're going to get more into how I'm able to do that or execute that on in the VR world. Because as we've explained it before, you can create these gorgeous rooms, videos. You can talk about different products and allied health and stuff like that. So anybody wants to know more about that, please contact us. We can talk about that in the future and tell you how, if you're interested, how we can integrate.
Media for You can set you up with your storefronts, get you all ready for your presence in the
websites, whatever you need.
In the metaverse, yes. So go on, I'm sorry.
Of course, my daughter's going to call me right in the middle of the podcast. That's interesting.
She has a question.
Oh, anyway, so back to why I chose it. See, where I have no doctors in my family, so when I went to school, I was into something about cutting the cats and stuff like that. I kind of like that, the pigs and like high school and stuff like that. So I went to college. I was like, ooh, I want to cut some stuff. So the lady was suggesting that, why don't you do biology? I was like, yeah, biology. And then she said, and then I found out probably a good year or so in that was kind of like a pre-med track I was on. I was like, pre-med.
I didn't mean to do that.
That's a problem. So when I started investigating medicine, the School of Podiatric Medicine came down, Temple School of Podiatric Medicine, and I read an article talking about history of amputations amongst the community, where there's at that time, it was over 250,000 non-traumatic amputations that were happening in the world. In other words, not an injury, what could be an injury, but not something traumatic. It was basically something like misguided information on how to handle your diabetes from home. Basically doing stuff that could be easily preventable. And that's the sad part about some of the things I've seen, is that a lot of injuries can be prevented. And so I spent my career trying to prevent that. Did my residency at Newman Medical Center in Philadelphia, Northeastern Hospital, which Newman Medical Center focused on limb salvage and circulator boots and revascularizing folks. We teamed up with orthopedic as well as the vascular groups there, and really try to do some great things. But I mean, that's my life in a nutshell in terms of medicine and podiatry. And like I said, my goal is to kind of save somebody one limb at a time or something like that. Like, so since I'm lower extremity,
right.
I do surgery. Well, I don't do as much surgery as before, but I still understand a lot of cases to see a lot of patients post-op from other issues.
You mind if I do something real quick?
Yeah, no, jump in there.
Usually your surgeries are gone after 3:00 or something like that, because usually you call me at like 2 or 3.
No, I don't do it. Look, let me tell you something. COVID did a number.
You don't really do much, because you call me and you be like, "Hey man, I'm going home." I'm like,
yeah, I don't. Yeah, that's just basically my schedule is set up now with the federal health, with a system that I'm in, that I don't do as much surgery. But anyway, that being said, I know people out there have questions. Iceman, I know you got questions. Let's go.
Wait, hold on. Do you mind? Let me real quick. Attila, you glad to be here. Hope everyone is doing well. Well, I'm sick, but I'm still doing well, but not feeling as good as I should be. But there you go. Now, questions. I see.
Well, I mean, I have just a little bit about me. So
yeah. Let's hear your story.
This will lead into the questions that I have. So I had I hurt my foot, and I thought, oh, I'm fine. I went to the foot doctor. They couldn't find really what was wrong. He says, come back in a month. I was like, I'm good, right? So like 5 months later, I had to go back because there was something else. He says, well, you need to inspect your feet and all this. And I'm like, okay, blah, blah, blah. I didn't really get it all. And then I got an infection on my toe. And then it got so bad to where like it was really bad, purple and black. And so then the doctor that happened to be on call was the one that I went to, and he opened the door and saw me, and he just shook his head. He's like, I told you to come back. You never come back. And so then that taught me the importance of listening to the doctors, and just basically follow-ups. But anyway, that led to my toe being amputated, which in turn, diabetes is really bad. So things just didn't heal. End up getting an infection below the knee, amputation. 3 weeks later, I was back in again above the knee. So since he said he was focused on the prosthetic part or the limb loss part, that was like we had that connection. But so I guess one of my questions is, which I hear throughout the people I talk to within like the prosthetic community, is not noticing, like, how do you check your feet and stuff? That's one of the big questions. My mom had that one too.
Well, I remember we talked about this earlier, and you mentioned the mirror. I mean, and again, what I just said previously, you just fell, obviously, we know now you fell into that, right into that category of non-traumatic, that had you just paid a little bit of a little closer attention, that would have been seen, because you just saw it and you just said, wait a minute, something's wrong here. But if it was on the bottom of your foot, you might not notice. Now,
I
I
didn't,
don't,
because with diabetes, you
the
can't feel
neuropathy,
your bottom of your feet also.
the neuropathy. Yeah, that's what I
Right.
was going to flow into. So all of a sudden you don't
Sorry.
see
Yeah,
it.
go ahead.
No, 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 you're perfectly fine. That's what happens. But daily inspection is imperative in terms of people with diabetes, especially if they have neuropathy. And for those of you out there who don't understand neuropathy is, it's just simply diabetes damages the nerves and the smaller nerves. And because the feet are in shoes, they get, a lot of trauma, right? Now, what I mean by trauma, I'm talking about walking,
That's trauma.
going upstairs.
That's trauma for them.
That's the trauma in a sense, because that excess sugar in the bloodstream interacts with the nerves and it damages them to a point where you can't feel. And that's why your podiatrist or your family practitioner or whatever doctor you see does monofilament testing, which is a low filament that's weighted at 5.07. Not sure the weight, but that's where it's the minimum point in which you can feel.
What is that? Is that the little thing they stick your
Yeah.
toes with?
And it
What?
bends.
How does
And it
that
bends
work?
a little bit. It's like a filament. It's the minimum that you should be able to feel, if I'm explaining it correctly. So if I hit you with that, it's like almost a little wire that
Okay.
has a certain thickness to it, and it applies a particular amount of pressure. Normal, you can feel it. Abnormal, when it starts getting to the neuropathic stages, you can't feel it. So it's not stabbing you with something that actually bends. It's like a little wire that bends.
And then so they say, like, because they did that with me, and they go, Tell me if you can feel
Yeah.
this," and then if you can't, then you're basically you have
You're
neuropathy
getting there.
at some
Yeah.
point, right?
Yeah. And then you have what we do is proprioception, where we grab a toe and move it up, down. And if I'm pushing your second toe up in the air and you can't feel it, we know we have a
We got a
situation.
problem.
So it's simple stuff like that. But as far as inspection, just to answer that question clearly, if you're diabetic, it's just important to inspect every day. If you see anything, follow up, because obviously in my years of treating patients, I've seen where one patient, a colleague from Texas, young guy, scraped his leg on the side of the pool. That's all he did. However, he had been educated on, dude, any cuts, any bruises, anything, like, please come in as soon as possible. He didn't do it. So he ended up in a situation, obviously.
All right, real
And
quick
it's sad
question.
because that's
Oh,
not
sorry.
traumatic. I mean, it's a traumatic little issue, but it wasn't like a car accident, anything like that. It
Right.
was just simple antibiotics would have probably cleared that right on up. And back to yours, Iceman, what happened with you is the toe became ischemic because it was caught too far, you know, it progressed a little too far. And in surgery, which I have done, when you're amputating a portion of the foot, you have to take it back until you see good blood flow. But
That's what
yeah,
they said.
right. And sometimes you can't really tell. Look, remember, bacteria expands exponentially. So that one little bacteria that's or a little bacterial area that's just kind of there, it just
Spreads.
exponentially grows and causes more problems. And then obviously when the bone gets infected,
How fast does it usually like the growth? How fast can it really?
really asking me technical questions like one quarter of an inch per what, man? It just grows,
Give
man.
or take, it goes
Asking no
fast. In a
technical
week,
Well,
I don't know how fast the
a
bacteria
week,
grows.
2 weeks. I
But it
mean,
goes quickly though,
okay.
honestly speaking. It's relatively quickly because it's growing exponential. One bacteria becomes two, two becomes four, four becomes eight. And, it becomes whatever number it is from a
It
microscopic or
multiplies.
pathologist standpoint. It
and
grows.
obviously your blood is traveling throughout your whole body, so it's pulling it all the time and moving it
Sure.
forward.
You could become septic. Yeah, septic.
That's what happened. That's what
Cellulitis.
happened with me on my below the knee.
Mhm.
It got septic where
Or you
I
got
should have
septic.
I did. Yeah, I did.
That's what I mean.
And yeah, luckily I went back when I did, because it's one of these little stories where they say if you would have waited 2 hours, it might not be. We don't have a drug strong enough to stop this.
Wow.
Yeah. Yeah.
So
No.
immediate amputation went in there. Exactly. You had a question, Devlin?
So let's say, like for me, growing up, I've always eaten candy and just tons and tons of candy and sweets. And anybody that knows me knows that that's just my thing, candy. So early on,
Nerd ropes.
yeah, nerd ropes. I had some in here, but early on, my doctor had said, because that was a concern, diabetes, and everybody told me, you're going to get it. You're going to get it. I'm like, I'm not getting it. I know I eat a lot of candy and a lot of stuff. So my doctor was saying a lot of walking, a lot of circulation will help prevent that. Is that true? Is it, how do you
I think
prevent
he
it?
froze.
How do you prevent diabetes?
No, not diabetes on your feet. I'm just specifically talking feet, to where it's keeping the circulation going. Is that a thing? Is that necessary?
Shoes? Is it a shoe? Yeah, like
What? Okay, specifically with diabetes and foot issues,
It's
is
about
there
peripheral
ways
vascular
to
disease.
prevent it? Is there
Well, the walking thing is meant for, I think, mostly meant for what's called claudication. Did you have any cramping or anything in your feet
my
or anything like
legs?
that? Yeah, that's where the correlation came with the continued ambulation. You want to get the muscles used to working with less oxygen. It could be the claudication. I'm no vascular guy, but it could be arteriosclerosis or basically plaques in the lower extremity. We do.
Didn't understand any of that.
Did he squeeze the back of your calf? I'm sure
Yes.
he did. Right, to make sure there was no clots or anything
Yes.
like that. So they rule that out, and then what they do is, like I have a buddy in Atlanta right now who's dealing with some lower extremity wound that would not close, and it didn't close until he started receiving ablation procedures by his vascular surgeon to open up his vascular flow. And yes, ambulation just gets so if you do have some arteries that are just not working all that great, yes, vascular, but then increase walking to be able to increase the blood flow and get the muscles used to using whatever blood flow is available at the time for oxygenation of the muscles. But obviously, you follow up with your vascular surgeon in primary care for the medical aspect of it.
So as far as the feet go, I'm working with vascular also, and they have done several procedures to increase blood flow to my feet, because it's the furthest area away. So right now I'm dealing with a injury on my toe, on my, I'm gonna say good leg, my only leg,
Now,
and it's what's that?
you dealing with that now?
Yeah, I'm back in a cast
Right.
again. I've been in a
Okay.
cast for a long time now.
Yeah, quite a while.
Okay.
Because every week I go in and he takes it off and he looks at it, and then so. But I think in 2 weeks I'm going to be out completely. It's healed up really nice.
Good.
But that's the foot care part is, I don't have that blood flow down there to help it get healthy quick and heal quick. So being diabetic, and my arteries are all fried and all that. So I have to work with vascular also to make sure, and I go there every 3 months for them to do the ultrasound for the blood flow test. They put a little cuff on your toe, it's good stuff.
They're checking ABI, ankle brachial index. That sound
That's
familiar?
the word. That's the word. Yes, that's the word. Yeah,
Yeah, so
I was
ABI.
going to say the same thing.
You were.
No, I wasn't.
But yeah, so honestly, the care is relatively simplistic for the patient, not for the doctor, but it's a place that you just have to keep eyes on. And like I said, a mirror to look under your feet is just very important. A lot of people, one of my shows, one of the better videos that Devlin could have found, where I was talking about where people take their feet and they kind of put them on the shelf. Like when they find out you're a foot doctor, it's like, really? I guess an ingrown nail or two. And I'm like, dude, it's just a little bit more. Just a little bit more than that. I mean, so people don't think the feet are important until they become a problem. Like I guarantee you, at some time, you never really thought about your feet. You're like, just whatever. I'm diabetic, so what? I mean, yes,
Never.
somebody
I
might
know.
have said
I was a tale that, cautionary tale.
yeah. So that's unfortunate, and that's how society is. Like certain things aren't important because it's not happening to you. So if something's happened to somebody else, it's okay, but it's all of a sudden a problem when it's happening to you. You know what I mean?
Exactly.
So
Yeah.
anyway,
Yeah.
so Look, so that's what the inspiration was for my book. Feet. What I did was Feet Naturally, and Feet Naturally. And if anybody wants to look that up, that's fine. It's called Feet Naturally Diabetes, and you have to put my name. Amazon's got my book kind of jacked up, so you have to kind of look for it. And
How do you
also have
spell? How do you spell your name exactly?
MA.
That's where people make a mistake. They don't put that extra A.
They
'Cause
missed
that's
the
what I
extra
did.
A.
That's what I did.
I was gonna say the same thing.
Yeah, you
Maasi Smith.
Yeah, you got to put the whole thing in there. You got to put like Maasi Smith or Dr. Maasi Smith, and then you have to put Feet Naturally Diabetes or Feet Naturally,
That's
because
true. Yeah.
they have my books as one book almost. It's weird. Like sometimes you find one, sometimes you find another. But if there's anything interesting in there, really, I hope people find some good interest. Not all about foot massages either. It's about natural products that can help heal. Remember, we had natural products in this. Look at me.
There it is.
There he is,
Yeah,
ladies
I
and
don't look
gentlemen.
like that. I don't look. Yeah, I look better than I think. Now I'm just aging.
But I bought the book, and it is an easy read. It's very informative. My son has it right now, or I would have pulled it out. But he was reading it also, and he said, "Dad, this guy, he doesn't know what he's talking about." I'm like, "What do you?" I go, "What do you mean?" Hold on. I go, "What do you mean he doesn't know?" He goes, "He says that if I have diabetes and I have foot problems, that I should limit my alcohol use." And he goes, "That's not going to happen. That's bad advice. That's bad advice." And I'm like,
that's not gonna
well, I
happen.
mean, the advice is good. You're just not going to
You're
listen
just not
to
gonna
me.
listen. That's all.
You can develop, and a lot of people don't know this. Well, obviously, you can develop neuropathy from other things, including what's called alcoholic neuropathy.
Great.
I didn't know.
Yeah,
I
yeah.
didn't know that.
Overconsumption of alcohol over a long period of time. I've dealt with that in a clinical setting.
No more bourbon.
You can also drug use neuropathy. That's something that will cause peripheral nerve damage, and there's some medications that your doctor will sometimes prescribe, and that could be a side effect as well.
Right.
Overuse, but they keep up with that more than I do.
Do you happen to know, like for foot health, is there a natural? Because it's about naturally. I know you actually helped me out. You told me about something that I said, oh, it's too expensive. The medicine, the cream was too expensive, and you told me about something that was purple, and then I went and got that, and then I found out that my foot doctor, has a thing of it on his
the low purple thing.
Yeah. So what was that stuff? That's for people out there if they have a injury. What is it for? Yeah.
Well, I'll tell you something. But see, here's the thing. I will do the disclaimer. Look, I'm saying what's been used in the history, but people out there do not. If you have specific instructions by your primary or medical professional, follow that.
Yes.
I asked my doctor about it after you told me about it. Yes.
My belief is that we've got all these medicines over the past 20, 30, 40, 50 years, 60 years, whatever. Now all of a sudden the pharmaceutical company's like, ooh, let's make all this money. However, there was stuff that was around before all that helped heal. Now, one of the early things I believe is this product called Gentian Violet. I'm not sure exactly when it was developed, but it's this purple stuff. I have no idea how I fell into it.
Say it one more time.
But Gentian Violet is $7.
Gentian
$7. Gentian, Gentiin.
Okay.
1% or 2%. It's an anesthetic. It's purple. It's messy as hell. However, that stuff will clean up a wound in a heartbeat. It's really, really good from my experience, people. Because we're in a litigious world. Somebody will sit there and be like, "What he told me?" No, I didn't tell you nothing. I told you to follow up with your doctor. I'm telling you what I use.
My doctor agreed with you.
I believe it. I'm not talking about you. I'm talking about the world. This is open to anybody to hear.
The world.
Next thing you know, I got legal papers like the next week. I'm like, what?
Can I just real quick interrupt you guys real quick?
So,
just if anybody has
go
any
ahead.
questions that's out there watching right now, put some questions on there. If you guys have any questions for Doc, and I'll go on and ask the question. So you can keep going, Doc.
Where's my dad? He's still on here? You better ask a question.
No, he's not here. Oh, and Tracy said like father, like son, by the way.
Oh, thank you very much.
No, I'm not talking. It was Iceman. Like father, like son.
Not listening?
Yes.
I think it's the not listening.
It is.
That don't listen to the doctor. But no, my doctor, actually, I was so fortunate to get him at the emergency room when I had to go to the emergency room. It was him. I'm just so blessed. It's a smaller practice in Tacoma, Hilltop area. It's Tacoma Foot and Ankle Clinic. The staff there, Christine, is just phenomenal. His name is Dr. Hwin.
We're doing a shout out.
My wife could.
We're doing a shout out.
My wife could tell me his.
That's good.
Yeah, he's a
Yeah,
podiatrist.
What's the
I
name of
went
the
to school. I
practice?
went to school.
What's
Yeah.
his?
Oh, yeah, you
What's
went
the
to school with
practice
him.
name?
That's correct.
Yeah, I recognize the name, but I think he was behind me or something like that. Or you mentioned it before.
What's the practice name?
Yeah,
What's the office name?
it's Tacoma Foot and Ankle Clinic.
There you go.
Nice,
That's exactly what it's called. And the only reason I went to them the very first time was they're the only ones that took walk-ins. I was hurting, and I was like, we got to drive down the hilltop, which is,
Yeah.
you know, an area down in Tacoma.
And
But
you could
anyway,
actually walk
it was
in.
kind of, yeah, it's far away, but we had to go there.
Gotcha.
And then, yeah, I was just, it's a blessing to deal with him. He's all about like just making sure, taking his time. I've been fortunate to be with him for all
Nice.
these years. Anyway, I
Yay.
just want to put a shout out.
No, the thing about podiatrists is because we're so focused on what we do, we take a lot of pride in
Right.
exactly what we do. You
I
know
can
what I
see
mean?
that. What are you
Yeah,
looking for?
because
You
we don't
okay?
have to do like the primary care physician. Yes, we know some things, however, because obviously you have to learn when you're in school, general anatomy, physiology, pharmacology, and all that type of stuff in microbiology. But once you get into your practice, you're actually just really focused down on that. So that's why when
Right.
people come in, you kind of look and you kind of like, all right, I see what's going on. And I say, well, how'd you know that? Because somebody else said they have pain in a certain place. And I'm like, yeah, well, you have spurs on the aspect of your foot. When you get up in the morning, it hurts like crazy, right? Like, yeah. When you walk a little bit, it kind of clears up. Yeah. Plantar fasciitis. Like, dude, I was in here for like 1 minute. And I'm like, give me my
he did to
copay.
me.
Give me my
That's what I had.
copay.
That's what, and he said, he goes, just go get a brace. And I was
Yeah,
like,
just go get a
well,
brace.
which brace? Just go get a brace.
Just go get a brace.
That's it.
So,
No,
Don't overthink
so that's
it.
the
'Cause
best
that's
thing
my
about
problem.
us. Yeah. And
I know
what
a
else we
big
got?
one. Big one is that plantar fasciitis. That's what I thought I had.
Yeah.
I self-diagnosed myself with that
Oh,
first, which was incorrect.
yeah.
But apparently that is a big thing. I
Oh, it
know a
is.
lot of people that have it. You want to explain that a little bit?
Plantar fasciitis, just very common. Nobody really knows where it comes from. It could be increased weight loss, increased activity,
And
and actually I have a spa
Oh, wait.
that
Can you go back?
that's
Can you go back to
what's
that?
that?
I'm sorry. You said fast weight loss?
Well, anything that stresses the feet. So your feet are working with a certain weight every time it takes a step.
Right.
Angle your gait analysis, right? So if you gain weight, that causes stress in your feet. If you lose weight, that's a different type of stress in your feet. So any activity can cause,
I
or if
didn't
you
think of it
do an
that way.
Me
athletic
neither.
activity can cause pain. And your arch, the plantar fascia is here. So, this is your foot, right?
Right.
And it stretches the back, and this is where the spur comes from. Now, I will dispel one
That's crazy. I had
thing
never
is
thought of
that
that.
yeah, the spurs, it's usually 99% of the time is not what's causing your pain. Everybody think it's spurs. We say spurs because it's easier for you to grasp what we're talking about. But it's usually the plantar fascia that's pulling Wolf's Law. Bone will react based on the forces placed upon it. Dang, I sound smart, don't I? I mean, just
It's almost like
coming up
he's
with
a
that stuff.
doctor.
I know, right? Where you guys know me in the metaverse, and I
Yeah,
don't be
I know.
doctoring it up in there.
So
That gets
Mandy
crazy.
has a question. Mandy
Mandy.
has a question for you. Question for Doc. Any recommendations for pedicures or foot massages?
Really, Mandy?
Well, Doc does a lot of good ones. We saw it on the video.
Really, Mandy? That's all you got, Mandy? I'm sitting here talking fancy words, and you come up with, is there anything?
And I read
to-
it, and I read
What'd she
it, and
say?
I go, all right, here we go.
You got a question? Yeah,
And we did
Epsom
ask.
salt.
that's true.
Epsom salt, yeah.
I've been told Epsom salt.
See,
Yeah,
look,
a long
drops-
time.
Look, that's all you had to do.
See, good question,
Yeah.
Mandy. Good question.
Yes,
But-
excellent question. All right, so
Yeah.
aren't we doing something like November, December?
Right. So, yeah, I got it right here. So, listen, everybody. And hold up, before I do this, I want to get a shout out because I know you gave a shout out to your doctor, but I want to give a shout out to Vaughn Podiatry, Alabama. I think he's in Montgomery, Vaughn Podiatry, Foot and Ankle Associates of North Carolina was my buddy Clarence and that crew, and Dr. Fitzhugh and Jason Miller up in somewhere in Pennsylvania, Premier Orthopedics, Brian Pontarelli, who's out in Rhode Island, who also has a spa. So if you're trying to get some things in Hatch, he'll help you with that. So Brian Pontarelli, Jason Miller, Dr. Hadrian Vaughn, it's Vaughn Podiatry in Alabama, and Dr. Clarence Stewart in North Carolina. I'd like to give those guys a shout out. So if we become really, really big, people see this old episode and they'll get business. The hell was your question?
I didn't have a question.
Heart initiative. We were talking about raising awareness.
So
Stay on track.
Heart.
Stay on target.
Stay on track.
Stay on target.
Listen, guys, like we said, we're trying to give back as well as we get. Yes, we're 3 old guys doing a podcast. A lot of our stuff is based on opinions. We don't try to get into any real controversial stuff. We're trying to make things better as best we possibly can, and the power that we have, which is limited. However, we can increase that power by doing some important things when it comes to the world and how we can put our little 2 cents in and help out. What we notice is a lot of people are having difficulties out there, not because this is not political climate. It's just the world in general. You have people starving all over the world. You have people that just can't get the basic necessities that they need. And we know we can't affect it all, but we can affect something, right? So we developed the Heart Foundation, and it's not official yet. This is something we're working on, helping every American reconnect together. And keep in mind, even though it says American, oh yeah, right, Heart.
Yeah,
That's it, right? I said, oh yeah, Heart.
No, you said it right. I'm just telling everybody that's what it. Yeah, that's the.
Okay, Heart.
Yeah, H helping.
A great acronym, right? So and keep in mind, people, we come up with this stuff together, and I love working with these guys. And that's all credit I give you.
This is Doc. This is Doc. Yeah.
So what we're doing is we're trying to establish relationship with entities in our particular areas where we can offer some sustenance in terms of like Thanksgiving and Christmas, whether it's food, toys, and whatever we could do this holiday season. As you've seen, we've given you plenty of time. It's May. So we're going to be having initiatives, clothing drives. We're going to team up with certain organizations. Iceman, you have an organization that we're teaming up with?
Want me to tell you about it?
Yeah, let's go.
Absolutely.
Yeah.
Okay, so
definitely
in my local area, it's called the Eatonville Family Agency.
Mm-hmm.
It's ran by Kylie Hutchings, and she's a director of it. And then also I work with Emmy Lay. She's also a contact person. And they do everything. They're just doing something now about a trash drive, which they got a big dumpster, and for all the local people for like $20 donation, they can dump their trash, and so all that's going to the family agency. But that's just one thing.
Right.
I contacted them, and they would love for us to work with them a little bit on that. And so that's my charity of choice. That's what I'm going to do. But they feed people. They do, Christmas families that need help, that they can't, Christmas presents, everybody. This is community's great. Eatonville community is just very helping, giving, and they also help outside area also. That's Eatonville Family Agency. I will be promoting that more. And making some videos and stuff about that when I talk to them and make sure everything's good. But yeah, Eatonville, that's who I'm going with. Yeah. They're just outstanding.
Yeah, and I'm going to be working with some children's homes, so I'll get to that and get more into explaining that later when I get more information on it.
You're doing good. That's what you're focusing on.
It's going to be some children's homes, some
children minister.
Well,
awesome. Awesome.
You're a children's minister, So
it's going to be some group homes and stuff. Yeah. So Yep.
One of the organizations I'm going to work with, it's Covenant House. And Dr. Stooks over there is doing a fantastic job or a community awareness as far as really, it's an inner city clinic in which I'm at, and they're doing a phenomenal job. There's some great people out there. And Dr. Stooks. Well, no, I'm not gonna start naming people.
Yeah, because you're gonna miss somebody.
Then what happens? I'm gonna miss somebody. Tiffany Albin. But anyway, no, but they really have.
He drops a couple more.
I'm gonna make them all help me. Now. I haven't officially teamed up with them, but what I did do is their presentation in reference to VR and how that helps in clinical evaluations and education and we do have engagement.
Just for context, we do have a Covenant House inside VR already set up for them. So
we do.
You guys are listening.
One for Eatonville Family Agency.
You guys are listening.
We
can do that. Place in VR healthcare for that.
Yep.
Yeah, how much you got?
We'll work something out.
No. So no, we're always open to bringing more organizations. But we did, and thank you, Devlin. Actually, both of you, because you guys do the technical stuff. Thank you for setting that up for Covenant House. And stuff like
that was fun.
And
that was a lot of fun.
And DeVault Law. DeVault Law. We got to give her some love up in Woodbury.
LLC,
she's doing
she's
doing some fantastic work.
Please go to her website.
I'm learning stuff with working with her.
Yes.
Yeah.
Yeah. Oh yeah.
Yeah. She's good lawyer.
Okay, I do have a story. I'm just going to bring it real quick, and this has to do with DeVault Law and actually you, Doc. So I'm getting ready to head up to Seattle next week.
Woo-hoo!
So I'm going up there and I'm like, all right, I got to get my ticket and blah, blah, blah. So I bought my ticket. And then Doc decides to send a message in the messenger. Hey, don't forget about your real ID. Okay. I don't have one. So then I start looking. I'm like,
I gotta get mine.
Man. So then Mandy sends me a message. Hey,
Uh-huh.
Devlin, can we make a blog about a real ID?
After the fact.
I was like, well, she sent it to me, I guess, first before Devlin got involved. And I said, we're working on this blog. And then I was like, didn't you read the stuff that I'm putting together for Amanda? Like,
oh, it was hilarious.
It's all about the real ID.
Right, I know. And I'm like, yeah. So needless to say, I'm still going up there next week. We're all set. I'm ready to come up there. So yes, thank you, Mandy, for getting us all set up with my real ID.
Give her claps. Give her claps.
Yeah, wait, hold on.
All right, Amanda.
We're going to take that control from you because you don't know how to use it. I don't hear claps.
No, I didn't. That's because I didn't hit the other button.
The claps are going to be like next week.
Yeah, it's like 2 weeks later. Bro, we're going to
But anyway, thank you, Amanda. Yeah,
thank you, Amanda. So,
by working with you.
One of the things with medicine, I know we talked about football. Oh, now with our Heart Foundation. Now, listen to our motto, our family out there in the metaverse, multiverse, real life.
Yes.
Listen to the motto that us three have come up with.
Come on now.
Because things are hectic. In the chaos we give, in the giving we heal. That's the motto for Heart.
There we go.
Foundation.
One more time.
No, I want to clap next time, dude.
No, that's what I'm saying. One more time.
Okay. Do it again.
So our foundation Heart, helping every American reconnect together, and that means everybody, not just American, okay? And the chaos we give, and the giving we heal. Bro, that's just nasty right there.
Come on,
that's just nasty. That's just nasty. I try to get a man credit and he just kills it.
I know. You see that?
No, I just know that's you guys. I was impressed with that. Really, that was hearing that was actually good. I'm glad.
So,
we are
naturally like that.
So excited. But one of the things I wanted to end toward the end of the show, and I know we're getting there, is that people need to understand with virtual reality and the metaverse, right? Virtual reality is just not gaming, folks. Get it out of your head.
Please.
Just like you use a computer for business and you can use a computer for gaming, the same with virtual reality. You can use it for gaming, but you can also use it for business and some real educational opportunities, please. So you'll be surprised how major universities are using VR to further explain, and that's the presentation I did at the Covenant House. Major universities are using this to educate their students, educate their patients, show, like you have a boot, right? So Iceman, so you have a boot. So sometimes there's some training. If you have a crutch, there's training. So not only can the doctor do it, but that can be reinforced in a nice immersive 3D environment. And it's hard for you to get people to understand how immersive it is. So there's one video I want to share. What you got?
Real quick, I'm going to add on to what you're saying right now. They're all going to understand this in about 6 to 7 months when Google releases their headset, because it's going to be for production, or it's for productivity. So that's what it's going to be originally for. So once that comes out and everyone is seeing what that's like, it's going to change everything. So just so you guys know, we're in here waiting for you. So we've got it all set up for you. We've got it all laid out. So when you guys decide to catch up with the rest of us, we'll see you when you get in there.
If you're a doctor, allied health, whatever, and you want to have a place in the metaverse, and it's not like you're going to get all this business immediately. It's like there had to be a first website, a second website, a third website. That's where we're at now with VR. And all you people that I sent information to, and you're kind of like, keep saying then you'll be calling me, and I'm gonna charge your butt.
Yep. My sister fee was 25 feet. Now we're going to a 26 feet. Okay.
Were you gonna say
26 feet.
So my sister is involved, like she's in the multiverse, cardiac rehab.
What's up, Angie?
Right, that's right.
Yeah. So she wants to, she's busy with 2 kids and you know, all that stuff, but she's trying to also get involved in the healthcare and bring on like some cardiac information into it, you know, as far as storefronts and stuff.
Yeah, it's got to start from somewhere, right? So yeah, it's not the busiest platform in the world, and it still has growth and a lot of things it has to do. But you have to realize, if you know, when there's 1, there's 2, when there's 2, there's 4. Like the bacteria we were talking about. It's just going to be steady growth. I mean, in a nicer way though. So here,
what's the video?
I'm here, so I'm going to share. Give me 1 second. Let me make sure you guys got it. Okay. Hold up. We're gonna start with this one real quick. Your friends will appreciate this. Oh, look at that. Hold on. Look at that.
Can you get ready with the claps? I don't know.
Hold on. Hold on. Hold on. There we go.
Thanks for
This
queuing
right
that.
here. Oh, look at that. Can you guys see that?
Touchdown! Yeah.
Yeah, I'm sorry. I think it's going to be 34-0 at this particular time in the third quarter. So I apologize. I didn't mean to show people that or tease them. Can you guys see it?
No, I can't see it. I don't see anything. I don't know what you're
You don't see
talking about.
anything?
Yeah, I do. I see it. I'm just messing with you.
So I just want to make sure that was seen. I will change that. Hold on. I will change.
What are we looking at there?
Well, we're looking at the Eagles because that's what I wanted to do. All right, hold on. Here we go. Now, can you guys see that?
Yes, I see it.
Yes,
you can see
all the way. That's not you.
No, that's not me. But do you see? You see the
skill?
The skill, right? No. So basically, I'm showing this to show how augmented reality. Is that what you guys see? The skull right there?
Wait, what?
Yeah, wait a minute.
You don't see it?
Defense.
Right there in the middle.
Augmented reality?
Everyone in the world thought they were going to
Okay, so what they're doing, they're using augmented reality to basically visualize the person's face and understanding that, oh, wow, that was only 1 minute. But anyway, to understand, I wanted people to see how technical virtual reality and augmented reality is becoming. Augmented reality is virtual reality that's kind of an overlay on the real world, if that makes any sense.
No, I got it now. We see it so naturally that we don't even recognize it.
How hectic things.
Yeah.
No, not hectic, but let's see. Can you hear this? Is this up?
You can take it off.
And so much of this comes down
You can
to
see it
great
now. You can see
We
it.
saw it the whole time.
When you have these
Okay.
plays, you know how meaningful
And you
they
can see
are.
this VR healthcare for healthcare uses cases for VR.
Wait, no, we still see the football.
Season.
Do you really?
And there
Okay.
they are.
Oh, you still
My
see
name
the
is Dylan
football?
Shaw,
No,
and
that's
I'm
not
using
where I want
Upward
to. Here.
Now
Upward
we
providing
got
a
a
ton
commercial.
of options.
I got you.
for exact
Is that better?
Depression,
Now we got another commercial.
to manage
You're still seeing.
pain.
Wait, let me kill this.
The pain
While
management.
VR may not actually impact
VR.
the
No, this
physical
is right.
sensations in the body,
Headaches,
pain-specific
cases.
VR
Oh, yeah.
applications teach patients how to
Okay.
cope with
So
pain.
Healthcare
I'm
usage.
sharing this just
Positive thinking.
for people to be able to see the case
adjust
uses.
bodily
You're looking at
awareness.
this as bottom right,
Particularly with
tech
patients
target. Is that what
experiencing
you're looking
chronic
at? Why did I even
pain or
try
hunger,
this?
have
Oh, no, I didn't even know that.
Yeah, me neither.
Okay.
So it
or
has
other
the-
cognitive events
So
you
and
don't have to hear it, you can see it,
hallucinations
yeah.
from course.
So I just wanted
VR
to give
will not
people an
replace
idea, and
face-to-face
obviously there are many
interactions
other
and treatments for
cases
healthcare
in
professionals
reference
Nice.
in
but
reference
rather
to
serve
virtual
as another
reality and
tool
how
for
it
effective
can
treatment.
help people in their daily lives and medical care and where it's going. So that's
That's nice.
that's basically
Thanks,
so
Doc.
that's pretty much that.
All right.
Yeah.
So we're gonna wrap up. You're gonna stop sharing your screen there.
I don't know. How do I stop
Up
sharing?
on the top. Hit stop sharing.
There it is. Why you tell me that before?
Yeah.
Yeah, come on, technical guy. You're supposed to tell us this stuff.
Why is it still not gone? Why are you doing? What are you doing?
Is it? Did I stop sharing?
No,
it?
you didn't.
You
It's
just
still
closed
sharing.
the window.
You just closed the window.
Well,
You-
that's what I thought.
no,
All I
you,
had to
you
do.
want to stop sharing.
Down at what does the doc say?
Go
Three
down at
old
the
guys
bottom. Yeah,
trying
three
to
old
do
guys.
this podcasting
Down
thing.
at the bottom, you want to hit the share. Down all the way at the bottom, you see share, and then you can
Yeah.
close that. Just stop sharing. Yeah.
Hey, I'm making fun of it, but I can't do all that stuff.
Yeah. I don't know what you're talking about. Stop sharing. I see stop sharing
Up
right
on
now.
top.
I don't see stop.
Click all the way on the top. You should see stop sharing, top left.
Nope.
Don't worry about it. We'll leave a blank screen right there. Don't worry about it. We're going to close out in prayer.
Throw up our end with our logo or something.
Yeah, well, hold on.
Don't end with a black screen.
Let me see. Hold on.
Throw up the media for you, and we'll say goodbye, and then we'll play the media
I
for you, and
can't
we're
because
done.
he's casting. So we can't do it
All right.
until he's casting. So let me close
All
in
right,
prayer. Let me close in prayer. Heavenly Father, we thank you, God. I thank you for this podcast. I thank you for sharing all of this information today, God. Lord, I ask that you continue to help this podcast grow, help people to love one another and care for each other. We just love you so much. In Jesus' name, amen.
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 And
Oh, yes, sir. Go on.
the last part, I want to thank Pac-Man Jones for taking my call. Anybody know him? He's an ex-NFL player who was very gracious of trying to get us on the show, get him on the show. And we also we're following his show as well. He has a podcast.
Yeah, he's a real. I didn't know who. I
Yeah.
heard the name before, but he's like a real celebrity. Like he's a real. No, really, I didn't really know him until I started looking into him. So I
Yeah.
appreciate that with Doc.
That's
I was
cool.
like, dude, the guy is like, he's
Yeah.
known.
Yeah, he's
You know?
excellent. Yeah. So
Yeah.
I really appreciate him taking my call back. I talked to him, gave him the pitch for about a minute, and it was really nice.
Nice.
Awesome.
All
All
right.
All
right.
right. All right.
Thank you
Virtual
guys. Happy
Roundtable. We'll
Mother's
see you
Day.
guys later. Happy Mother's Day. Love you all. Toodles.
I appreciate it. And I messed up the screen. I'm not doing this that technical stuff.
Audio Jungle. Audio Jungle.